back. You're watching Connect the World. I'm Lynda Kinkade. Well, a sharp rise in coronavirus infections and deaths has plunged Brazil's healthcare system to the verge of collapse. The pandemic has killed more than 45,000 people in the past month alone. Intensive care units are nearly full, over 90% in several states. In Sao Paulo, a man just 22 years old died waiting for an open ICU bed. Well, city leaders are begging for federal help. Mayors representing 61% of the country say they desperately need medical supplies. But Brazil's president seems to be in denial, even as coronavirus deaths soar. Brazilian's president, Jair Bolsonaro, says there's a war against him personally. Well, Matt Rivers joins us now live from Rio de Janeiro. Good to see you, Matt. Ever since the pandemic began, the president there certainly downplaying just how serious this all is. I've now heard he's just named his fourth health minister since the pandemic began, and he is feeling the heat because of just how badly this has been handled.
I mean, all you need to do, Lynda, is look at where we are at in this pandemic right now. I mean, we're more than a year now after the very first death was recorded from the coronavirus here in Brazil, and things are worse than they have ever been. It was just yesterday that the second most deaths in a single day were recorded from the coronavirus. It was just 2 days ago. It was on Tuesday, actually, that the most deaths in a single day were recorded. So it's just a horrific situation right now. And it doesn't look like it's going to get better anytime soon, because what you need to look at is occupancy rates inside intensive care units across this country. You know, during previous waves, what we saw were different pockets of the country really being hit harder than others. It was just a little under 2 months ago, I was in the city of Manaus. That was up in the northern part of Brazil. It's an Amazon rainforest city, and that was undergoing a horrific outbreak. What happened there is now basically in every single state across this country. All but one Brazilian state now has ICU capacity at 80% or higher. 16 of 26 states are at 90% ICU capacity or higher. That means that if they haven't collapsed already, Lynda, those healthcare systems are at imminent risk of collapsing. And it is not just the rural parts of Brazil. It's not just the parts with less equipped infrastructure. It is also the state of Sao Paulo, for example, which is the richest, most populous state in the country. You said it in the intro. People are dying waiting for ICU beds. And unfortunately, I do not think that we are at the peak yet in terms of how bad this is going to get.
Yeah, it is especially dire there, and you speak about some of the numbers, that death toll continuing to rise and the daily death count breaking record day after day. Just talk to us a little bit more about inequality and how that is a factor there.
Well, I mean, there's no doubt that this is affecting poorer communities more than richer communities, but what's kind of morbidly fascinating at this point is that throughout this pandemic, you've generally seen, you know, a tale of two cities. You've had the private healthcare system used by the elite in this country. You've had the public healthcare system used by everybody else. Right now, even the private hospitals, ones that we have been inside, are at capacity. They are out of ICU space. We are watching a collapse not only of the public healthcare system, but of the private healthcare system. It has gotten so bad here, no matter how much money you have, finding treatment in Brazil right now is incredibly difficult. And, you know, in the past, maybe they could pull resources from one part of the country and put it in another that's not being as badly hit. Right now, there's no help from anywhere. Everywhere is being really hit. And we talked about the governmental response earlier. You know, you had Jair Bolsonaro, the president of Brazil, yesterday saying that this is a war against the president, talking about himself in the third person, basically saying that he's questioning how many people are actually dying from COVID in these ICUs versus other diseases. Let us be the ones to tell our viewers that what is happening in the ICUs right now is not because of other diseases. State after state after state after state is saying that their ICUs are collapsing because of COVID-19. The president doesn't want to admit that. He wants to talk about the economic threat posed by different lockdowns across the country. He's planning some protests potentially this weekend, even legal action against some governors who are actually trying to take restrictive measures to save people's lives. But if you look at the federal response, or the lack thereof, there is zero question that a lack of a coordinated federal response is leading to people losing their lives in Brazil. It is an ongoing tragedy, Lynda, and one that is calling out for government leadership that right now just isn't there.
And Matt, obviously the vaccination program has been subject to political disputes and delays. Where is that at right now?
Well, you know, it's especially tragic when you consider Brazil's long, successful history of vaccinating its people against myriad diseases. It's got the healthcare infrastructures to do so. It's got a willing population that is used to taking vaccines. But what you've had is a federal government vaccination rollout program that has been slow, and that's probably even just being generous. Going back to last year, they had a chance to procure 70 million doses of the Pfizer vaccine. They chose not to take that opportunity, put all their eggs in the AstraZeneca basket that they are producing here in Brazil. But delays in that production means that even though some doses were supposed to be delivered all the way back in December, the first 500,000 doses of the AstraZeneca vaccine are only getting delivered this week. Multiple epidemiologists have told me that it will be well into the second half of 2021 before there is a substantial impact made from these vaccines. Just I'll end here by saying that less than 2%, 1.6% roughly, of the population here, Lynda, has been fully vaccinated so far. An incredibly slow rollout program.
Incredibly slow, and they desperately need to ramp that up. Matt Rivers for us. Good to have you on the case. Thank you.